Center, and I'm Dr. Agarwal. This is Lisa Simeone.
Morning.
And we appreciate you joining us today for our first ever live broadcast on Instagram. So what I thought we'd do, and bear with us if we make any mistakes in this process, is we kind of just talked a little bit about Lisa's experience and what she's gone through and what she's experienced during her prior surgery. So just briefly, Lisa's now 60, right?
Yes, I am.
Which is hard to imagine. I first met Lisa about 5 years ago, roughly, and at that time we performed some procedures. I think we did an Uplift and
we did
to address the jaw and neck, and I did a revision rhinoplasty.
Yeah.
A little bit of fat transfer, and a small chin implant
you
at
did.
the time. So
yeah.
Tell me a little bit of what kind of prompted you to do those procedures at that age, and what led you down that road.
So Dr. A, I first of all, I'm really excited to be here to talk to you. I mean, all the time I've known you, we've kind of been in and out of the office on a more of a professional level. So it's really nice to sit down with you and talk to you about this. But I've always had some issues with some of my facial features and wanted to do some tweaks with them. And I felt that in my mid-50s, as I was starting to see the aging process really make those features feel a little bit more pronounced, I thought that it was time for me to make those changes. And I was in a place in my life that I could make those changes, and so I started on that journey, and I did a lot of research. My main residence is in Chicago, but I do have a second residence here in Florida. But I really wanted to find someone. It didn't matter where that person was. I wanted to find the best person for me, and that led me to you.
Great.
Yeah.
And I remember when I first met you and we first started speaking at your consultation, you told me a little bit about sort of why at that time of your life you were interested in doing something. So you were in your mid-50s, which is sort of I think a common age, at least from what I hear from my patients, or at least most of the female patients, is to where they start seeing some signs of aging that they want to address. Can you speak a little bit about that and the timing of that?
Yeah.
And I do want to mention, by the way, that Lisa's doing this out of the goodness of her heart. She's not being paid to be here. She's one of my most loyal, faithful patients, and I truly appreciate her being here on her own accord.
It is a pleasure to do it. I feel that it's almost like lifting the veil to talk to someone behind the scenes a little bit, because it's a scary thing for a lot of people, and I'm really happy to do it. It was an amazing journey for me, and I continue to go down that path with you, and I'm happy to answer any questions and be an open book to anyone who has any questions on it. It's been an amazing, incredible, and happy journey for me with you. I think what really started pushing a lot of buttons for me was my neck. And I think you probably see that a lot in women my age in that mid-50s, right?
Right. A lot of times people are able to manage the eyelid area, the cheeks, on the mouth with Botox and fillers and non-invasive lasers, but the neck has always been a troublesome area, and it's one of those things that can give away your age without even,
Absolutely. That's exactly what was happening. And I would wear turtlenecks. I could get away with that in Chicago, but even at that, you could see wrinkling around my jawline. So no matter what I did, no matter how many tricks, how many creams, it just got to the point where there was nothing that would help it except the surgery. And that's the point that I came to. So when I came to you and we started talking about the neck, what I loved about meeting with you was it wasn't that you said to me, okay, let's do your neck, but what about this and this? It was truly a partnership. And I really came to you asking, I had other things that I wanted to do, and it was more of a master plan, if you will. Like, I would like to do these things. What do you think? And we kind of talked back and forth about what we could, should, and wanted to do, maybe not now, but maybe over time. And it was really a plan.
What's interesting is sometimes I have patients who come in and they say, I want you to address a specific area. and they're very discreet and specific, and I have to be careful not to recommend other things because I don't want to either introduce something that they're not even aware of or offend them in any way.
Right.
And then I have other patients like you who say, Dr. A, what would you recommend to help me look my best?
Yeah.
And so in those scenarios, I'm able to then recommend things that you may not even be aware of. So like, for example, in your case, I felt like your chin was a little set back.
I was just going to say
you didn't
that.
come in for that.
Exactly.
But at the same time, that's not uncommon where, I look at you on a profile view, what you're not used to see yourself in, and then, I make a small recommendation that just enhances the neckline. Or, maybe something around with the fat transfer or something to that effect where it's just a subtle tweak that gives a little bit of an improvement, but you may not be aware of it. I think it's nice when I have that. I mean, I don't mind doing it either way, but I do have a lot of patients who do give me sort of carte blanche to at least give them recommendation, and they can pick and choose what of which I'm recommending they wish to do. And I think that's what you did.
That was a game changer for me. Well, first of all, I mean, I'm an interior designer, so I think that as a professional, you would want to go to someone and say, what would you do? I don't want to come to someone and say, this is what I want to do, period.
Right.
I would want to say to you, you look at faces all day long. I mean, I would say this is what's bothering me, but what are your recommendations?
Right.
And I have to say the chin was a game changer for me. I wasn't even thinking about that at all, but that changed everything.
Now, do you ever feel, people always ask, do you feel the implant? Does it bother you? Do you notice it when you're chewing or talking or smiling or kissing, any of those types of activities?
Not at all. Yeah. It's mine.
Right.
It's part of me. It's mine. I never feel it. I have a teeny tiny little scar. I don't even see it. And I never feel it. Doesn't move around. It's part of me.
Right.
Yeah.
Good.
Not at all.
And tell me about your nose. I know you had a prior rhinoplasty before I operated on you, but tell me what it is that you wanted to tweak or improve when you saw me.
So
it's been about 5 years since we did that as well.
Yeah, that was a tough one because my nose was not really the kind of nose that you would look at and say, oh, that person really needs to have a revision. It was just something that really bothered me. I didn't feel like it fit my face. It was a little bigger and a little thicker, and it always bothered me, always. And when I had my last revision, the doctor did the best he could, but said that there was a lot of cartilage there and that it really wasn't something that he could do much for me.
Okay.
And so I thought, okay, this is it. This is the way it's going to be. So when I met you, I really wasn't even going to ask you about my nose because I didn't think I could do anything.
Got it.
And you said absolutely, and we did those before and afters, which was
so
amazing.
Yeah, that's really helpful for the nose especially.
Amazing.
Yeah.
And you said, absolutely, I can help you, and this is what we could do.
Mm-hmm.
I think that was the most amazing transformation for me.
Right.
What you did, it doesn't look, it's so subtle and so beautiful. I'm so pleased.
I'm glad.
Yeah.
I'm glad. I mean, the nose is such a central part of the face. I mean,
Mm-hmm.
it's something that, patients who come in for rhinoplasty consults, it's bothered them for a long time. It's not something new. They've been looking at it all their life, and they finally have the courage to get it done. But they're always afraid of pain.
Mm-hmm.
People are afraid of that, or
Really?
damaging the nose, or trouble breathing, or anything like that. So, can you speak to the recovery process, both with the rhinoplasty and the lower face and neck lift to the chin implant? Just people want to know about things that they don't necessarily trust me to give the right answer on. And you can
tell them a tale.
Yeah, you can be brutally honest, and
Yeah.
whatever recovery was like. Because for me, what I care most about is the end result,
Sure.
and I want to get you there in the most comfortable way possible.
Right.
But for me, it's all about the result. So tell us about the process, the recovery.
Sure. So it's funny because when I knew that we were going to do this today, I know this sounds crazy, but I took pictures of myself every day after recovery.
Oh, you did? Okay.
During both surgeries.
Okay.
I wanted to just remember and see. And I have to tell you, I think I had discomfort for the first few days. I had zero pain. When I look back on the journey, I had no pain whatsoever. Everybody said to me, the rhinoplasty is going to be difficult. There's going to be breathing problems. You're going to get claustrophobic because you're not going to be able to breathe. I had none of that. I remember clearly the first day, and I had a lot that first surgery with
Sure.
you. I had the neck, the nose, the chin, the fat. So there was a lot going on. I had drains
Mhm.
in my neck on both sides. I had, packed nose.
Cotton balls in the nose.
Yep, and I had, the drip
Drip
right
pad.
under my nose. And I remember, it was just like I had a stuffy nose, like if you
Mhm.
have a cold and you have a stuffy nose. But the next day I was back here and
I took out the cotton
you
balls.
took out the cotton balls.
Yeah.
It was like the next day.
Yeah.
And I was groggy from the anesthesia. I slept, on and off that night, and then I came back and the cotton balls were out. So, I mean, there was really I think the most uncomfortable part for me was taking the stitches out. When you took the
Yes, a week
stitches out
later.
a week later.
That's right. So basically what Lisa's referring to is when I do a rhinoplasty procedure, I put a little cotton ball in the front of the nose on each side. And the purpose is just to hold a little pressure against the inside incisions and help reduce bleeding. And it's just there for one night. It's not deep packing. Like people think of your nose being packed
Not
up.
at
It's
all.
not like that at all. But you still can't breathe the first night. And then when I see the next day, I take the cotton balls out and you're able to move some air. It's not normal yet. It takes a few weeks for the stuffiness to go away, but at least you can move some air.
Absolutely.
And then at the 1 week visit, we take off the cast and the stitches under here.
Right.
If it's an external approach, which yours was. If it's internal, then I don't need to do that. But most of them are external, about 70%.
Right.
But this area is so sensitive that
right.
those stitches do hurt coming out a bit. But
Yeah.
tolerable.
But it was completely bearable.
Tolerable. I mean, it's
Tolerable,
just
yeah.
if you had to pinpoint something that was the most
That was
uncomfortable, that'd be
it. It was completely tolerable.
Yeah.
And you have the most amazing staff.
I do.
You have incredible,
I am blessed. Yes.
incredible staff.
Yes.
They are so soothing and so kind, and
They give you the
they
shoulder
rub
rub.
your shoulders. It is. I want them to come home with me and rub my shoulders when I'm having a tough day. But that out of all the things that I have had done, that like 2 minutes of a little bit of uncomfortability. I mean, even when the drains were taken out, and you said to me, this might, you had one person on one side and one person on the other taking the drains out at the
Burn for
same
20 or
time,
30
and they
seconds.
actually snaked under my
Right
skin.
under the skin.
And you said, this is going to be a little uncomfortable as we take them out. I didn't feel one thing.
Good.
I did not feel anything. I had zero. I think I was more anxious to get out there and see the progress
Yes.
than I had any uncomfortability or pain.
Good.
I was just wanted to get going and get healed, and the results were so almost immediate. It was incredible what I saw so quickly.
In our field, one of the reasons people go into plastic surgery is instant gratification.
Oh,
So
it's
in
amazing.
other fields of medicine, and they're all necessary, you have to prescribe a medication. It may take 6 months to see a result. Lower blood pressure or lower
Right.
your cholesterol, whatever. In plastic surgery specifically, one of the reasons I went into it is because of that instant gratification. You do something with your hands, and within a few weeks, you get a couple weeks of swelling, bruising. When that
Yeah.
stuff subsides, you see an instant transformation, and it's lasting.
Yeah.
So, speaking about results, as you then, because Lisa runs a very high-end interior design company out of Chicago, and it's a global firm, she works worldwide. When you left here after your couple weeks and you went back to Chicago and you saw your family and friends and your coworkers and your employees, were you open with them what you did, or did you try, or you not say anything and just see what happened type of thing, or did you tell them, and what was their feedback? What did they think?
So I'm pretty open.
Because a lot of people are concerned about
I know.
What they look like 3 weeks later, and
I know.
they're going to scare the bejesus out of me. So.
Well, that's always a concern, and I think going up to the surgery, I think that's usually that I think that was my fear. You get so excited prior to the surgery about what could be that it kind of overwhelms the fear a little bit, and then maybe the few days before, or the right before, then you start to get that, oh no, what am I doing? You get that little bit of fear maybe right close to the surgery. And that's when I started to look at the before and afters again. I went back to your website, and it reminded me why I was doing this, and I got excited again, And then I did tell a lot of people that were close to me, a lot of my colleagues, not everybody in the office. I have a pretty large staff, but my family and my close friends, my business partner, my husband, obviously. Of course, my husband, you're beautiful the way you are, don't do anything. You know, that's a tough thing to hear because you're thinking to yourself, maybe I shouldn't do anything. If you've got someone close to you saying, no, don't do it,
Yes.
you know, it's a little bit of a, am I being vain? You know, why am I doing this? But it's really very personal. You know, it's extremely personal. I give a lot of credit. I respect anybody who does it and doesn't do it. It's extremely, it has to be something from within.
And for yourself.
For yourself.
Absolutely.
Right?
I tell patients all the time, you know, don't do this to try to land a significant other, to try to impress somebody else. This takes a lot of internal motivation.
Absolutely.
And there's also a period in the first week or two for most people where there's almost like a little bit of a downer, because you go through this procedure, you look good to begin with, and you're just trying to tweak it. And then all of a sudden you look in the mirror and you've got some bruising and swelling and it doesn't look right for the first week or two. And we kind of give you a chart showing this sort of mood swing where you go in a down phase. And I kind of tell everybody, I say, and it doesn't matter when I tell them this, but I say, just give me 2.5 weeks. Give me 2.5 weeks, because ultimately we need that time to get through this phase.
Dr. A, that chart was amazing. I forgot about that, but that was an amazing chart. That kind of giving you the tools to expect, what to expect, was so helpful, because you don't know what to expect. You know, you're kind of not pushed out the door, but you're like, okay, you're great,
right,
here you go, and then you get home and you think,
you look and you're like,
oh my gosh,
what have I done?
Exactly.
Yeah.
But to know, okay, I'm gonna be good, let me get over this hump, it's so helpful.
And that's where trust comes into play. You know, that's where, and not only trust, but also I think pre-op counseling, expectations, knowing what to expect as much as possible. I mean, you never really know until you go through it, but knowing that's all part of the pre-op counseling. And
yes,
you know, you and all patients spend an hour with our nurses like Leslie and go through pre-op counseling and what to expect, and
absolutely,
you know, how to care for it and so forth. But
it's key. It's key. But as far as telling everyone, when I did come back after my surgery, I have to tell you that not a lot of people noticed a big difference. And I think that's the beauty of what you do, is that it's so well done. The subtlety in what you do, Dr. A, is so beautiful that I think people know something's different, but they can't quite pinpoint what it is. And I've had even other doctors, I have doctor friends and crazy hairdressers high-end hairdressers that have seen, I'm sure, a lot of plastic surgery they can't believe the stitching that you've done. I mean, the teeny tiny beautiful little stitches, so well done. I mean, no one can see my scar. The scars are so minimal. And again, I know that people aren't quite sure, and I've had friends say that I think the fact that I've done things a little bit over time in a gradual way, and continue to tweak over time for me, instead of just doing one big thing or at a later date, you know, maybe now in my 60s, has been very good for me, because it's allowed me to make small changes and not look like I had something done.
a night and day transformation.
Exactly.
Right.
Exactly.
I have some patients who don't do anything, and then they come in at the age of 70 or 75, and I do a full makeover, because at that point it's, you know, you just have to take care of what's there. But
right.
I do think that there's a huge benefit. Like people always ask me, what's the ideal age to have a surgical procedure for facial rejuvenation? And I kind of give this window of 55 to 62. That's not to say it can't be a little bit earlier, and certainly can be later.
Right.
But the tissue quality is good. The skin thickness is still good. As we age, we do tend to have things thin out, and it doesn't hold up as well in terms of longevity.
Sure.
You started, at least aside from the nose, you started with me about age 55. You're now 60 years old, which is amazing that she's 60. I can't believe that. But just to recap, the way that you did it was 5 years ago, you had the Uplift, lower face and neck lift. You had a little bit of fat injection, chin augmentation, revision rhinoplasty.
Right.
And then 2.5 years ago, approximately, I did your upper eyelids.
Correct.
And we did a laser on your full face.
That's
laser resurfacing. So can you talk a little bit about the recovery from the upper eyelid procedure and the full face laser?
Yes.
Because the laser is something that is kind of scary, and it's kind of intense.
It is.
So.
It is. So the upper eyelid was a breeze. I mean, that was that recovery from that was almost nothing.
And what did you see as an improvement with that?
Oh my gosh, when I look back at the before and afters, I looked very tired, more than I thought I did. When I look at the before and afters, I had a very hooded eyelid look, and I remember thinking right before the surgery how I couldn't wait to I know this sounds silly, but be able to use, makeup in a way that I could see it, because when I would use it, it would just kind of sink in, and everything just fell into creases that were just so heavy, and
I hear that commonly.
you do?
Yeah, absolutely.
Yeah.
Yeah, especially the eyelid makeup and with the skin overhanging, and it smears in there.
Exactly.
I can't relate because I don't put it on, but I've heard of many patients.
I didn't realize that. I thought it was the only one,
No.
but my office actually is above a Sephora, and so every day when I pass the window, I'd look at all these makeup kiosks, and I'd think, oh, I can't wait to be able to use you and you and you. That recovery was so easy, and the results were so amazing. I just feel like I woke up,
Okay.
and very quickly, the stitches were so small and they dissolved so quickly, and it was just such a quick turnaround on that.
Good.
The laser, I think, took a lot longer for the recovery. That one, I think, that one took me by surprise a little bit more than I thought it was, because of the results were amazing, but the downtime was longer than I thought it was going to be.
Yeah, so let me speak to the laser a little bit. So laser, of all the things that I do, the laser resurfacing is the thing that takes the longest to heal from.
I was surprised at that.
And there's different levels of laser resurfacing, but regardless, to get a meaningful result, you have to go to a certain depth in the skin with lasers.
Right.
If you do it superficially and you have a couple of days of downtime, I just don't see enough of a change. So the type of laser that you had, I think it was, if I remember correctly, it was probably about 10 days initially, where it was like a red raw surface, and then it heals and it's smooth and bright pink.
Yeah.
But depending on the person, it can take anywhere from a month and a half or 2 months up to 3-4 months plus, even higher, for that pink to go away. So you have to wear makeup to cover it.
That's right.
But at the end of the day, what it accomplishes is not really achievable with just a surgical lift, or cutting something out. It's really a surface buffing, textural improvement, wrinkle improvement, just overall improvement of the tone of your skin.
And I had acne scars residual from my youth. I had a lot of little fine lines, and I think it was just kind of the icing on the cake after I had done all those surgeries. It was really changed the tone of my skin, and I was really happy that I did it. It was during the healing of it, that I think now knowing, I understand now, but during that time, it took longer than I thought it would. Yeah.
I hear that definitely from most of my
Do
patients.
you?
I do.
Yeah. Yeah.
Leslie, before we continue, is there any question that's come in or anything that we had to address? Okay, so we'll keep
No
going.
questions.
The next thing I wanted to talk about is just sort of, so we've talked about the surgical procedure. I generally do recommend going from inside out. What I mean by that is, working structurally to lift the elements that have fallen or augment the volume underneath the skin, lift up the muscle layers of skin and so forth. And then the final component, if you're going to do it, is the laser resurfacing. So that order makes the most sense.
Yeah.
And that's what you did.
Right.
Now, I know you've done some Botox and fillers to maintain. So why, like even after the procedures and everything, why did you choose to continue with those type of procedures? And I do tell my patients that that's something that does help to maintain the result, but maybe from your perspective, what are the areas that you noticed needed a little tweaking along the way to have you looking as good as you do?
Well, I do believe that, I believe it's an art as much as it is a science, and I think that I believe that if people think that it's going to just be a one and done, I think that can't be right in as far as I'm concerned. You know, I think that, you know, even though, you know, we continue to talk and move and, you know, weight changes and, you know, you sit in the sun for a little too long, or, you know, you squint at something, so, you know, things might slack a little bit, or, you know, you might still get a few wrinkles, or I feel like continually maintaining with you has been part of my maintenance program overall. And so every 6 months I come back for Botox and fillers, and that has really maintained the result.
I think that's important because sometimes people think that once they do a facial surgery that's it. They're done, they don't have to do anything else, and they can just sort of let it ride for the next 10, 15 years.
Right.
And while it's true that when you do a procedure, I believe that you will always, for the rest of your life, look younger than your chronologic age, because we're setting the clock back. You still do age afterwards, so it's not like whatever result you had at 1 or 2 years is what it's going to be at 7 years.
Right.
Now, some of facial wrinkles and some areas of hollowing that develop, or some deficiency in volume over time, can be prevented or treated along the way and prolonged or postponed by doing Botox, fillers, those types of things, or small laser procedures. So, you know, Botox has a preventative benefit also, because you're relaxing muscles that cause wrinkles.
Right.
And so over time, the wrinkles are less likely to become etched in your skin. So you're a good example of somebody who's kind of, you know, you've had the laser, which helps with some of the, what I call static lines, the lines that are there at rest. But when you have movement from smiling, from frowning, from concentrating, those lines are called dynamic lines, and they are best treated with some things that, you know, for example, Botox that relaxes those muscles. So I think it's nice to see somebody who does maintain afterwards. Although you don't have to do that, it does help prolong the results. And so, you know, somebody who doesn't do that may find themselves having a procedure done again at a shorter interval. Whereas for you, you might be able to get, you know, maybe wait 10 years to do something again, something to that effect. I mean, I don't think you'll ever have to do your nose again, for example. That I think is done. I don't think you'll ever have to do your upper eyelids again. Over time, there will be some settling in the neck that at some point down the road, you know, we can address. And then, you know, we'll kind of watch the other areas. I mean, a lot of the areas in the cheek and forehead area can be managed non-surgically, and that's kind of what we've done in the past. So, you know, we'll just kind of watch it as we go forward.
And Dr. A, that's what I love about working with you. I feel like this is a partnership, you know, and you and I are working together to maintain and, you know, continually watch what's going on with my look, and it's given me confidence that I'm not going to, you know, I have somebody on my side on my team that I can say, I can come in and say, you know, hey doc, I'm having this little problem here, what do you think I should do? I'm not liking what I'm seeing over here, or what's new, like what's happening in your industry, because it feels like it's constantly changing on your side of things too, and I'm always interested in seeing what's happening, and you're so open and you're learning new things on your side, you know?
Yeah, I mean, I try to adopt new techniques or technologies as time goes, but I'm on the spectrum of adopting things that I believe will have a result.
I know.
So there are many things that come and that are promoted as being the greatest surgical alternative and offering dramatic results. But if it's something that lasts a few months and that involves a procedure that could cause a problem, then it's generally not worth it to me. It's got to be enough that I can look at a before and after photo and be able to pick which one is the after photo. There's too many examples of procedures and new technologies that come out where you see the before and afters and it's hard to tell, and that's, to me, is not something I can stand behind. So like I'm only going to incorporate something into our practice or into my armamentarium that's going to have a noticeable, sustainable result that you're going to be happy with.
I know.
That's the name of the game, right?
Yeah.
For me. I mean, my greatest joy is in seeing patients like yourself be happy.
Yeah.
Ultimately.
I know, because I've asked you about things and you're like, no. No,
Yeah, I don't
we're not
sugarcoat
doing
it.
that.
I don't sugarcoat it.
But what about
Anybody
this new
knows
thing?
me,
I
I'm-
rip things out of magazines. How about this? No, you're not going to see results with that. But that's good, because, I want that. I want you to say no if it's not going to work, or if I want to do something that is not going to look good on me, or I want you to say, Lisa, you don't need to do that. And we've had those conversations before, which is exactly what I want.
So finally, I wanted to wrap it. One thing is, you're a busy professional, and I have noticed patients, especially with this recent pandemic, they're spending a lot of time on Zoom calls,
Sure.
and doing virtual meetings, and kind of managing employees and clients and projects from afar. Have you noticed when you are on those calls? Have you noticed that people or yourself or other employees or other clients or other coworkers are talking about how they look on virtual platforms? Because I'm hearing it from my patients. I'm just curious, from somebody in the business world who works globally. I'm sure you're having those meetings as it's harder to travel and things like that.
Absolutely. I think we have these discussions all the time, and we're all, this past year and a half has put everybody on the screen.
Mm-hmm.
And so we also have had discussions about where it's going from here, now that everybody's kind of a little bit back to normal.
Mm-hmm.
And it seems like there's some kind of hybrid that we're going to maintain for the most part in the working world, where it's going to be part, at home work and part in the office world. So I don't think that platform is going to go away fully anytime soon. And so I think people looking at themselves constantly, you can't help, even if you're looking at people on the meeting, you cannot help but look at yourself.
Of course.
And constantly like,
and adjust the camera.
oh my God, I look terrible, and it's forced everybody to take a really hard look at how they look,
Right.
From the neck up. And so I think that really does also have an effect, and we all talk about that in the office, and I think, and we've read the articles too about how that's caused your business, I'm sure, to change dramatically in terms of, people wanting to look better
Yes.
on camera.
Yeah.
I don't think that's going to go away.
Do you feel like all the things that you've done and the impact that it's had on your self-esteem translates at all into your professional life and how you carry yourself and how people, and is it important in your professional life with how other people perceive you?
Dr. A, that is a loaded question. That is a huge question. And for me, it is probably so important for me. I'm in an image business, and so it's really important for me. But for my personal journey and my personal self-esteem, it has changed my life. When I feel better and more confident, then I can go out there and sell myself, because I am my company. So I can sell myself with more confidence, and also I don't feel my age. So I don't want my look to reflect my age.
Absolutely. Yeah.
And so I think if I don't feel like I'm 60, but I look like I'm 60, everyone's going to react to what they see on the outside. So if I don't look that way, then the reaction I get from the people on the outside is going to be exactly what I want if I don't look it,
Right. Yeah.
And so for me, I can sell I feel like I can sell the services I want better. It reflects my brand better, because it reflects who I am better, which is not the demographic of a 60-year-old person with a firm that is 60, that reflects a 60-year-old mentality. It's more of a psychographic. It's a lifestyle, and that's how I feel. And you've given me that, with the look that it's given me a completely different way of expressing myself and facing the world. It changed everything for me. The confidence that it's giving me personally is just incredible.
Good.
Yeah.
Glad to hear
Thank
it.
you.
You're welcome.
Thank
Thank
you.
you. I'm glad. So that pretty much wraps up what I had to ask Lisa. So just to recap, Lisa, 5 years out from one procedure, 2.5 from the other, has done several maintenance things along the way. I think hopefully you found this to be informative and educational. It's one thing for me to speak to you about what to expect after procedures, another to hear it from somebody who's been through it.
Yeah.
And it's done a variety of different things, so she can speak to each procedure, and she has. So I really want to thank you for being so open.
Thanks, Dad.
And taking the time on your own time to do this. It's really, really generous, and I really appreciate your support of myself and our practice. Unless there's anything else that's come up, is there anything else you wanted to mention? Or?
No, it was completely my pleasure, and
And this was your idea. I was
yes,
like,
it was.
I'm learning from my patients. I'm not huge on social media, but I certainly recognize the importance of it. And Lisa's the one who mentioned to me about considering an Instagram live video and seeing how it goes, and it's actually been kind of fun.
I think that
And we always have a good relationship anyway.
absolutely,
so it's
absolutely,
easy to do.
yeah. Well, I think that for me, I would want to hear what it's like from the patient's perspective,
Mm-hmm.
and so I think I think it's good. You've got such a great practice, and you do amazing work. So anything I can do to help people understand the level of commitment that you have to your patients and professionalism, your staff, your colleagues. I'm so happy to help. I think you're amazing.
Thank you, Lisa. I appreciate
Thank you.
it. All right, we'll wrap it up. Thank you.
Okay, thank you.